Since the start of the pandemic, doctors have been seeing a spike in eating disorders in children and in teens. So today we're going to be talking about the early signs of eating disorders so parents and experts can intervene. I'm joined by Dr. Sandra Antonovic. She's a pediatrician with Providence to give me more insight on this topic. Now, doctor, tell me about what could have caused this spike.
We commonly see eating disorders show up most often when kids are hitting puberty, but during the pandemic, many children got off track with their routine schedules, exercise and eating habits, and began also to feel more isolated and began fixating more on social media. That, in conjunction with less access to preventative medical care, where we catch these things early, definitely seem to be factors in this spike.
So, what are some of the signs or clues that a child might have an eating disorder?
Sure, you might notice that they have a change in their relationship with food. They may limit the range of foods that they eat, maybe preoccupation with it, counting calories, restricting, stashing foods, skipping meals. They may be weighing themselves or commenting how unhappy they are with their weight.
So, parents should be on the lookout for signs of eating disorders in girls and in boys. Is that right?
That is correct. There are many different types of eating disorders. The one we most commonly think of is anorexia or bulimia or binging and purging. Since the pandemic, we've actually seen an increase in eating disorders in boys. Boys have tended to be more presenting in terms of avoidance and restriction of eating because of distractions, be it from electronics use or loss of routine and social isolation.
So, say a child is displaying these signs, what should a parent do to intervene?
Start with a conversation. Listen to your child, ask how they see themselves, how they feel about their body. Take them to their doctor for a preventative checkup to screen. That's part of our routine process when we do preventative care. We'll ask about eating habits, nutrition, and then if we identify anything concerning, we will work with the family to come up with a treatment plan for your child. And also, most importantly, let your child know that you care and that you're there to support them.
With that in mind, how can parents promote their child having a healthy body image and a healthy relationship to food?
Well, first of all, focus on good health rather than weight and body size. Remind your child that healthy people come in all shapes and sizes, and media is just not a realistic representation of how people look. Prepare and eat healthy meals together. Model a positive body image with your kids. Monitor and limit their social media activity, and help your child foster real world connections and positive engagements in the community.
Doctor, this has been such an enlightening conversation. Thank you so much for talking with us today.
Thank you.
Health Watch, sponsored by Providence Health and Services.